Well, Dr. Gold, we talked about LASIK, and what we found out here, what I found out here at least, I think is very refreshing. One of the most refreshing things I found about it is that once the LASIK surgery is done, it's a done. It doesn't go away and fade away after a couple of years, and then you have to do it again and can't do it because it's not anymore doable or something. So that's a great thing. Let me ask you, however, this question. What is the most common question, fear, or perhaps misconception people have about LASIK surgery? What should they know about it which is really important to them, that they A, do it or don't do it, or that they do it with an easier mind because they don't have to be worried about it? For instance, can I go blind? Can you actually slip with your knife and cut my eyeballs out?
Well, remember, I don't do LASIK anymore. I do EPI Lasik, in which there's no cutting of any kind.
Right.
And so
Okay.
safety has really become a non-issue.
Okay. On that aspect, let me ask you something here. So you don't do LASIK, you do, what was that word again?
EPI Lasik.
EPI Lasik. Okay. But the purpose of doing it on both of them is the same. It's just the instrument changed, the technique changed.
That's correct.
But the outcome and the reason we do it, it's all the same.
I believe the outcome with EPI Lasik to be better.
Well, okay. That's a given. That's a given. Thanks for reminding me. But, the basic reason, again, I think we established 4 reasons. Nearsighted, farsightedness, stigmatism, which is having a blurry vision, or needing reading glasses. So any one of those, you do it. LASIK or EPI Lasik. EPI Lasik is just no more knife involved, no more cutting involved, so less danger.
Correct.
And but yet it lasts kind of forever like the other one, and it gives you the same, well, forget that word again, it gives you better result than the other one. All right. So we got that one handled. So you can't cut my eyeball out, so there's no way for you to even, now I see blurry, and after the surgery I don't see at all. That isn't going to happen.
There's always that risk. Every time you have any eye operation, there is a risk of going blind. I think it's important for people to know that I've done over 10,000 LASIK procedures with only one complication. That happened in the year 2000, and it was based on lack of the technology that we have nowadays. So this particular young man, we didn't know not to operate on him. He would have been screened out with today's technology and never have received the surgery.
Got it.
Of EPI Lasik, I've done over 1,000 of that procedure with 0 complications.
Wonderful to know.
Nevertheless, it's important for people to understand that with any procedure that they do, there are both risks and benefits. And I spend a great deal of time with my patients educating them about the risks.
Right. Very no doubt about it. No doubt about it. I mean, we, giving blood can come to complications. Invasive is invasive, and that's all there is to it. Do you understand? I got that. We can't cross the street without, really having 100% certificate that nothing will happen. Good. I got that. Now, what would you, tell to people who have, let's say, one of those 4 symptoms which we said, farsighted, nearsightedness, blurriness, needing reading glasses? What would you tell them? And let's assume the person is in around 25 years old, kind of like, so his eyesight is grown, he's one of those, not a young kid anymore.
The first step is to come in for a free screening, during which time I evaluate some certain parameters of the eye to make sure the person's a good candidate for the surgery. Once we know they're a good candidate, then they have the choice of whether to proceed or not proceed. And during the free screening, I explain the procedure so they know what they might be getting themselves into. And I talk to them about, most people think that it hurts. Well, it doesn't hurt during or after the procedure. In most other practices in this area, people at that point will have been evaluated by assistants, technicians, or other than the surgeon himself. It's not what happens in this practice. I do the screenings, I do the surgery, I do the pre-op workup, I do the post-op care, I do it all by myself.
And is the operation done in your practice, in your case?
Yes, it's done right here in the office.
Okay. Good. Now, okay, so what should people know? Are they out of a job for a day or two because of, arresting the eye, or is it a week? What are we talking in terms of effort, in terms of time and bodily handicaps before and after the operation?
The only day they have to lose from work is the day of surgery.
Really?
After the surgery is performed in the morning, I have them go home and take a nap for 3 or 4 hours. And then when they get up, they have to use a lot of eye drops, but they resume their normal activities. And although it seems counterintuitive, the people who do more normal activities heal faster than the people who lie around.
Well, it doesn't sound so counterintuitive to me because from a kid on, I don't know how it came into my mind, but when I hurt myself, tweaked the little thing or whatever, I tried to use it. Whatever it is, whatever I heard, I tried to give it as much use as possible. And I know Mom and everyone else told me, rest it. And I, for some reason, I said, oh, okay. I walked around the corner and, I tried to move the shoulder. I did karate and those, whatever a kid does. And so constantly running around hurt with something. And I always tried to use that body part as much and as fast as possible. And everybody told me the opposite. And I never believed in that. So nice to hear that. Good. So basically there's no real downtime. I suppose the person should have a friend, family member picking them up and not drive home right away and that type of stuff. But that's normal and a given. Anything else a person who is considering LASIK surgery should be aware of?
I think that the fear factor of just not knowing is the biggest hindrance to people having the surgery. And that's why we offer the free screening, so that they can come in, find out whether they're a candidate, find out what it's all about. One of the other aspects is people are concerned about the expense. And in most places around, it has become quite expensive to have this surgery done. My practice, I've managed to hold the costs pretty much for the last 10 years. To a reasonable level. And we do offer a discount to members of certain health plans. They have to get in touch with us to find out which health plans those offer.
Fine. Well, it looks to me, I don't know whether it may not even matter, but one of the reasons probably a person like you can keep costs down, there are probably many reasons, maybe eating a little bit of the profit, blah, 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 but it's also because you do one thing and you do it well, so you're like set up. It's almost like a restaurant who has 3,000 dishes on their menu. It's very difficult to do it versus a restaurant which says, look, we have 5 dishes, take it or leave it, but those 5 dishes we can do well and we can be cost efficient because we have less spoilage going on. You think that's part of it?
I think that's a great analogy.
Great. Wonderful. Well, all right. So basically a misconception of fear, because, why wouldn't somebody have fear of somebody poking around in the eye? Do you know what I mean?
Yeah.
It's rather... but realizing that technology, when we call technology today, we talk about computers and iPhones and that stuff, but it simply looks like the technology has not bypassed treatment of the eye.
The technological advances since we started doing LASIK in 1995, actually the PRK was 1995, LASIK was 1997. The technology has advanced unbelievably dramatically. We're doing things now that are offshoots of the space program. One of the things that we do is track the movement of the eye as we're going, and that technology came from fighter jets locking their radar onto a target. The tracking technology is basically that. we now can take an image of a person's iris before the surgery and line up the laser exactly aligned with their iris. And that's how we treat astigmatism as precisely as we do. So this technology is mind-boggling.
Great. Absolutely wonderful. It is amazing, and it is wonderful, and it is very, very beneficial. I think if we overall take care of our body, give it nutrition and stuff, which is, in my humble opinion, the only area where we fall down and literally fight all the technology out there to help us, because we're kind of starving the body to death by giving it donuts, pizza, and otherwise preserved food. But that's just my opinion. But the other type of technology, be it from a hip replacement to this, I just talked to a lady, she had a hip replacement, and 3 days later she was arranging a body. And so, and you say the same thing. So absolutely wonderful. Thank you very much, Dr. Gold. It's really great to hear about those advances, and so people shouldn't fear that much. Go get a good information, and yes, go and find a guy who is not a trade of all jacks. And I know that's degrading, because every doctor is a doctor and he's licensed, and this is is his area already. But what we have learned is that even in a very specialized area like an eye, there still are many, many different areas, and it is wise to choose a guy who is doing that one area, and that's what he does. And seems to be also price advantages, because he can keep the price down because of it. Thank you.